Thank you. The total number of COVID-19 cases worldwide stands at 17.8 million, with the highest case totals outside the U.S. in Brazil, India, and Russia. CBS News senior foreign correspondent Elizabeth Palmer reports from London. Liz?
Good morning. It's now 6 months since the World Health Organization declared coronavirus a global emergency, and back then, very few people had any idea just how virulent it was going to be. In southern Australia, authorities declared a state of disaster this weekend after a big spike in cases. For the people of Melbourne, it's back to strict lockdown and an 8 p.m. curfew. And there are setbacks in Britain, too.
Our assessment is that we should now squeeze that brake pedal in order to keep the virus under control.
So millions in northern Britain who had been getting back to something like normal are facing fresh restrictions. Across Europe, with an uptick in infections, mask wearing is now strictly enforced, even at the beach. French and German officials are so worried they've started free COVID testing at airports. While in Berlin, a huge right-wing crowd fed up with all the restrictions marched in protest. But Europe's infection rate, about 8,000 new cases a day, is dwarfed by the disaster unfolding in India. 50,000 new cases a day, especially in poor and overcrowded slums, which puts India on course to overtake the United States as having the worst outbreak on Earth. South Africa is facing a crisis too, with 3 times as many COVID deaths as it had a month ago. And in a radical concession to COVID, Saudi Arabia has cut the number of pilgrims journeying to Mecca in this year's Hajj from 2 million to a scant and socially distanced 10,000. These recent upticks in Europe followed broad loosening of the restrictions, and public health officials think that people just stopped being careful enough. John?
Liz Palmer in London.